Let's head south now. A Cromwell GP fears lives could be in danger when the only after-hours urgent medical care service in central Otago shuts its doors from 10 p.m. starting tonight. The clinic is based at Dunstan Hospital, and for the last 3 years it's been open between 6 p.m. and 8 a.m. for patients from around the district like Cromwell, Clyde and Alexandra, to name a few. But concerns over shift length and safety means there's not enough doctors willing to staff it. It will now only be open from 6 p.m. until 10 p.m. Dr. Greg White is breaking ranks. He says out of a sense of moral obligation, he'll be on call to his patients from 10 tonight just in case. But others will likely have to rely on limited ambulance services and hospitals more than an hour away in Dunedin or Queenstown. I asked him why his colleagues decided to close the service.
I guess they've drawn a line in the sand as a group and said we can't do a 14-hour night shift and then work and see our patients as well the next day. There's been some staff turnover, I think, and it's just not sustainable. There's gaps in the roster, and they just couldn't provide the service anymore. So, which is a shame. It has worked pretty well for the last couple of years, but So there just hasn't been a solution found, despite lots of meetings with the District Health Board, the local hospital, St John's, the Mayor, you name it. Everyone's had. They just haven't come up with a workable alternative. But it's the reality of rural medicine, really, both general practice and the local hospital. Our main issue is we don't have an emergency department in our region. Our nearest one is probably Queenstown or Dunedin.
So what's your worst fear with this situation that you're now facing? What's the worst that could happen in your view?
I don't need to imagine, because I've had all the worst case scenarios happen over the last 20 odd years. So with calls being missed, no ambulance being available, people being called away to other things, and it only takes one ambulance. Once an ambulance is called out, then there's no other ambulance available. So
has anyone ever died to your knowledge as a result of that?
It's hard to label blame ever, but there has been unfortunate breakdown. It's more breakdown in communications rather than lack of availability. But at that time there was people, and that's with the entire system up and running. Things can still go wrong. We're a long way from help. The helicopter takes an hour just to get here alone. So you're having no medical practitioner available in the community for around 15,000 people is, I can foresee a bit of a recipe for disaster.
So do you fear someone will die as a consequence of this new arrangement?
I guess that's the worst case scenario. Yes, I'd say yes is the short answer to that.
So how would you describe the situation then? If you wake up in the night and you've got chest pain or something, and there's no doctor at the after hours, you have to rely on ringing 111, hope that an ambulance is available, or that you can be chopped out if it's dire. So how would you describe that situation? Inadequate. In one word, it's inadequate for towns the size of ours now. You've got to add in the fact we get a lot of holiday makers over summer. There's going to be you can probably double that population, and there's going to be a hell of a lot of ambulance call-outs over the Christmas period, and nowhere for them to take patients. So, in a nutshell, what needs to happen?
I think everyone is talking. We need to keep talking and so on. There needs to be some cleverer thinking about funding, because it always comes down to money. Both for us and for the local hospital, because Yeah, the main problem we have is they're only a small hospital and can't.
You need more money. That's it. Bottom line, you need more money.
Bottom line is more money. Not a huge amount. I mean, we're not talking millions of dollars.
Could you put a figure on it before we go, Greg? Could you put a figure on that?
Possibly 6 figures. Yeah, we're probably looking.
So for six figures, you could save lives.
I think, yes, you could put it that way. Yep.
Dr Greg White there. Dunstan Hospital's Acting General Manager Debbie Laurie says the service's reduced hours will be a challenge for the hospital because it doesn't have an emergency department, nor is it funded to have a doctor on a night shift. She says the hospital will always put patients' care first and liaise with ambulance staff as to whether patients with urgent needs can be seen at the hospital, but it will still be trying to figure out what to do if patients turn up on their doorstep unannounced.